Thank you, Senator O'Mara, and it is an honor to be in the 58th Senate District. And for you to have I think, a most outspoken state senator that really is advocating for the needs of all of the district here. I have served with Senator O'Mara in the Assembly and now in the Senate, and he's got your back, and he's trying very hard. To Janet and to Lexus and to Gail, you know, losing a loved one or going through the trauma and the grief that you have gone through, and to Gail being able to have somewhat of a victory. You have all given so much hope. And to anyone who is going to try to limit and say that we can't is unfortunate, because the more we go around and do these task force meetings and have public address meetings, there's a lot of moving parts, and there's not one solution. But I got to tell you, it's evolving, and where the state was to where we are today, it has been the state Senate Majority Conference that has really catapulted and thrusted so many of the ideas that the panelists have already brought up. We know that there's gaps in the system. We know that there is inefficiencies still that needs to be addressed. We know that we need to go and tackle big insurance companies and get them to pay more for longer treatment. We know that we can do more on the law enforcement side, and we struggle every day in the state Senate to how do we work through that wall sometimes that's in the state assembly that a lot of times blocks a lot of these great ideas and initiatives that's already been mentioned here today. Reforms to laws to policies to funding. And we need to do, everyone together collectively needs to work together, as you are doing here. We need to work together on driving the message home to the New York State Assembly, because they have blocked a lot of great initiatives and advancements so that it could curtail or eradicate this crisis that we have. Substance abuse is a huge problem, and I'm not just narrowing in on opiate or heroin addiction, even though that was the topic tonight, but substance abuse and the wide spectrum of it. It grabs a hold of an individual, a hold of a family, a hold of a community that is just deteriorating the quality of life throughout the state of New York. And we need to do everything possible collectively to fix this. So thank you so much. God bless you all, and I appreciate the time and the stories.
Thank you, George. Senator Rob Ort.
Thank you, Senator O'Mara. I want to thank you for hosting this event. I want to thank all of you for being here tonight. And I certainly want to thank the panel and echo the comments that have been made by my colleagues already. And, you know, I think when you look at this panel up here, and this is my 4th or 5th hearing across the state, you'll see a whole range of spectrums. You have law enforcement, you have family members, you have legislators, you have superintendents, you have public health officials, you have service agencies, and that shows you how complex, how dynamic this issue is, but it also shows you that there is no one thing. I wish there was one thing we could do that would fix this. I wish there was one thing we could do that would save lives, but unfortunately there's not just one thing. We're going to have to do a lot of things, and then after that we're going to have to recalibrate and probably do a lot more things. It's not just funding, it's not just this or that. It's going to be a lot of things. It's going to have to be a comprehensive approach. And that's one of the reasons why we've done these hearings across the state, is to try and get a sense from the people who live this every day, from the survivors to the families to law enforcement officials, what is going to work. This has to be thought out. This cannot be just a reaction. This cannot be just, I need to get in the headline tomorrow, or this cannot be something bad's happening, so we need to do something. We need to do something. We need to do something that works. And, you know, for these families over here, it does no good to them. And for these guys sitting over here who go out every day and put their lives on the line, it does no good to them if what we're doing isn't effective, if what we're doing doesn't work, and if we don't take into account what they have to say. I wanted to specifically mention Janet, who I know gave, I mean, all of you gave very heartfelt and emotional stories. Janet talked about her son, and one thing that resonated with me was she said he was a veteran of Iraq. And I was a veteran of Afghanistan, and I know a lot of veterans who come out and who suffer from mental health-related issues. And as chair of the Mental Health Committee in the Senate, I see this all the time with self-medicating, and a lot of veterans are being struck by this very epidemic, this opioid and heroin epidemic. These are men and women who served their country in combat, who wore a uniform, who wore the flag on their shoulder, who did amazing things, and yet they come back, and it's not Iraq that gets them. It's not Afghanistan. It's not ISIS or the Taliban or some insurgent. It's heroin, which I think is really tragic and ironic. And on a good side, we've started the Joseph P. Dwyer program in Niagara County. It's a program that exists elsewhere in the state. It's a peer-to-peer support service. And basically one of the things that they're going to start doing is going to the VA, working with the VA when veterans are coming out who have been there for heroin or drug treatment. They're going to be there to get these guys or these girls right when they come out, because that's one of the most vulnerable times, which we heard about, when they are discharged. That 48 to 72-hour time frame is when you see a lot of relapses and actually a lot of deaths. But I know you'll probably remember your son in a lot of different ways. I think you should remember him certainly as a soldier and as a hero for the country. So, and then last but not least, I'll just say that, you know, we heard a lot tonight too about marijuana. We heard I forget who it was talked about 5 previous unlawful marijuana possessions. And I met a family in Niagara County whose daughter passed away late last year, and they came up to me and they told me that their daughter, who was 22 at the time, told them that this all started when she started with marijuana. And I know there's a lot of different opinions on this across the country, but all I can say is most of these folks here whose loved ones are either recovering or are not here, I guarantee you they didn't start with heroin. They started somewhere with something else, and that led to heroin. And so I think we have to be very realistic that it's not always a victimless crime, that there are such things as gateway drugs, and there are such things as entry-level drugs that lead to something a lot more significant. And while substance abuse is very serious, this heroin epidemic is very lethal. You don't come back from this one, you know, for very long. And I think that everyone up here gets it. We're all trying. We're trying to find a solution. But there's an ownership that's a part of this as well. And I want to thank all of you because you're owning it. By being here tonight, you're owning it. Because if you think that it doesn't happen in your community, you're wrong. If you think it doesn't happen in your family, you're wrong. And if you think that it's just going to go away by itself, you're wrong. So I want to thank you all for being here, and I want to thank my colleagues for being here as well.
Thank you, Rob. Next, we'll go to our colleague in the Assembly, who's fortunate for me to serve in my Senate district, which includes Yates County, Schuyler County, Steuben County, Party-Chemung County, and Seneca County for Phil. Before we get to Phil, we do want to get to whoever in the audience would like to speak, so if you could move over by their microphone and line up against the wall. We'll get to you as soon as Phil is done. But
listening, certainly the members of the panel who are up here offering your expertise, but most importantly, the 6 of you at the end of the table for having the courage to share your personal stories. You put a human face and human side this growing epidemic that's affecting every community throughout the state. And as you heard, and as we all know, this doesn't matter what color you are, whether you're rich or poor, upstate or downstate. This issue knows no boundaries. And to have you come out and take the time to share that with all of us should give us all motivation to try to solve this problem. So thank you again. I did just want to say, just to my colleagues here in the Senate that, and the members of the community, our Assembly minority did actually have hearings around the state last fall, and we just wanted to make sure we presented that with you. There's some good ideas, a lot that we heard about today, that as you guys go forward and as we look for legislation, we believe there's some good ideas and blueprints in there to move forward, and we certainly have to act. We do these forums and we get this input, but it's imperative for us to act, and it has to be a comprehensive approach, from prevention to rehab to detox to recovery to education to help with law enforcement. And certainly, we need to take the stigma off this and treat this as a disease, and not be afraid to tell the insurance companies they have to be a part of the solution. But we have to do it together. It has to be a community effort, and I think the people at this table signify their commitment to make this a community effort. You being here signifies that you want to be a part of this community effort to solve this problem, and we just want you to know that we want to be a part of this solution and help as much as we can as well. So thank you for coming out. We appreciated your testimony, and we look forward to hearing from the audience as well. So thank you very, very much for being here tonight. Appreciate it.
Thank you, Phil. We'll begin with you at the microphone. If you could please state your name, and if you're with an organization, state that, or otherwise just state where your hometown is so we have an idea of where you're from. And out of respect for those that are in line behind you, so that we get to everybody, please keep it to a couple minutes. We look forward to, and thank you for standing up and addressing us here tonight.
Hello, my name is Reverend Ryan Smith. I'm from Penn. First of all, I'd like to thank our state legislature for coming down to address this issue. As a clergy member and a freshman in high school, a lot of students approach me with their problems. And out of all the things that I've heard, drugs is one of the number one things that I heard. And I want to stress that we need to be teaching children, our students, that we are on the front line. We're the ones who are interacting with the kids who are doing these drugs and who are being exposed to these things. So, things like natural helpers and other groups that teach students to help other students, their peers, who are struggling with this issue. I hear it all the time. And I think our students really need to step up, because we're the ones who are on the front line. We're the ones who are being, when it comes to the schools, the number one people who are being affected by this are families and are being exposed to this. And so I really think students need to learn how to stand up and talk with their peers about this issue. Thank you.
Thank you very much.
Hi, I'm Christina Cleveland. I'm the mother of Miranda Cleveland. She's a 17-year-old who died unexpectedly November 9th, 2015, from a heroin overdose. She was a senior at Dundee School. Her death is being treated as if she was another junkie off the street. The New York State trooper that is investigating the case has made some very inappropriate comments 2 days after her death. He said there was one way off heroin and she just took that exit. He's also made accusations, assumptions, took her character from a family that didn't know her, where she was doing the drug activity, where the OD took place, instead of her loving family of almost 18 years. He's not asked anyone. When I do call him, I've never met the man face to face, so I have to call him. When he decides to call me back, days, he acts as if he has no time for me. I have a case overload. I'm too busy. I do believe we need more. We need more officers. I'm being treated. I couldn't tell you the last time I even talked to him. I can't tell you where a case is at. All I hear is we're waiting, we're waiting. Thank you.
Thank you. Thank you very much for sharing that with us. And our heartfelt condolences for your loss.
Good evening, and I invite anybody who's a note taker to get their pen ready. I know a lot of people have tucked them away. My name is Carrie Ahern, and I am a village resident here in Penn, and I have been inspired by all of the members of YSAC, whether I'm an acquaintance of theirs or a personal friend of theirs. And I just wanted to share with everybody here in our community that I am working with the Penn United Methodist Church. We are going to bring a program to Penn called Celebrate Recovery. This program is a Christ-centered recovery group, but it is for anybody and everybody, to include addicts, but also to include people who are codependent, or if they have an anxiety behavior that they're covering and masking with an addiction, whether it's substance abuse or behavioral based. And for more information, we're going to have a public information meeting at the Methodist Church on Sunday, March 20th at 6 p.m. in their basement fellowship hall. Thank you.
Thank you.
Good evening. My name is Pamela Finger, and I'm a member of YSAC, and I've also been an educator in the New York State education system since 1993. In my 23 years in education, I've come in contact with a countless amount of youth in the Steuben and Yates County areas. Lately, I've talked to several former students who are and have been affected by this heroin problem. And they've all told me the same thing. We need more education past 5th grade. I'm asking that we listen to these young people and figure out how to get more education out to all students earlier rather than later, before it's too late. Because I don't like to go to another forum and have a former student come up to me and say, Mrs. Finger, we need help. And we need help now. Thank you.
Thank you.
Okay, this is going to be the strangest of all. I'm going to guarantee that. I've been here about 2 months. I grew up in Elmira as a small child. I moved Boston, New York, Ohio, Kentucky, Florida, Georgia, Illinois, and Colorado. My mother just passed away, so I decided to come home, and this is what I call home. I will tell you that the cities that you're referring to, less than 1% are enjoying if they have a community center, so the rural isn't necessarily it. And forgive me for not thanking you all, but we all know we're out of time. You guys are doing your jobs. You guys are doing your jobs. But here's where I'm coming from. And this has been ignored for the last 2.5 years. There is no presidential candidate right now that's going to address any of this. We don't know whether it's going to get better or worse. The state has no money. The government has no money. The schools have no money. There's a side of this that doesn't need money. I am thrilled that first 2 church members came up here. One of the reasons I came back to a small town is that I need a family. I am on the streets and I'm already running into people I know. Dennis, one of our superintendents, has already heard my story a bit. But a legislation or an idea or a understanding needs to pass that is free, and that is to let the people know who know. These, if you can't find an NA meeting, I have news for you, you're the one starting it. Where am I coming from? I'm from a generation back in the day. My father died of alcoholism. Many of us had the same situation, but I suffered from that, and I went to adult children, women who love too much, and those, I mean, everything out there. And I finally barged into an AA meeting and lied for 17 years about not being an alcoholic. Rare, but that group of men had the secret, and it was free. It was $1 in the basket for the coffee. What I'm saying is that if this is a small town, and we have churches coming together, I have been to 2 of them. I'm trying to make my way to all of them. I heard the best words I ever heard, which one of them said, all the churches are coming together. We need the churches. But as far as the schools and getting better education, why is this gentleman not telling his story? I have a story to tell, but because I'm not all these certifications, the certified people can assist, but if you don't use the people who have been there, done that, this mother said, I knew nothing. Guess what? She knows what this mother may need to know tomorrow. This entire community can answer the phone when she calls and says, I need help. And we can sit there with coffee in a lobby somewhere until the help gets there. Because if we just put 92 things on your desk that said, give us money, this is a community. I have a picture in my phone when we were this big on this lake. We don't need $600 condos. We need some canoes. There was 10 of our kids all together, meaning our friends. And I said, no wonder we were happy. We had 10 kids, and we were all in bathing suits. I'm going to say something that's going to really upset people, but please understand I'm aspiring to go to University of Pennsylvania for my master's in positive psychology, which is get these kids off of drugs, and I'm talking about the little ones. I went on a middle school band tour, and there was this many drugs for our children. It isn't the pot that got them stuck on it. It's that we did not teach them how to get over anxiety, and we didn't teach them how to get over depression, and we didn't teach them how to deal with some of these issues. I was a college recruiter for 10 years, and I had a gentleman come to tell me he was the only one in his school who had not been on Adderall. The drug laws for our children in school needs to change now, that it's not every kid has ADD. I know the educators, I know people. They come out and they are used to being given a tool to deal with what they're going through. I will give my card to all of you guys. I will give my card to you guys. You guys are all doing great jobs. But the educators, let us in. Let us in who can help your kids. Why can't we? When I was in psychology, you all heard of arachnophobia? Okay, we studied it on a book. We looked at it on a piece of paper. But it wasn't until we saw the video of the true guy in the corner sweating, shaking, and vomiting that we realized what it really was. And it isn't just, he's afraid of spiders. And it's the same with heroin. He can't come in like this and just tell kids don't do it. And posters and all that, nothing. But he can come in with some serious video and go back to the world of Scared Straight. You know, Breaking Bad romanced this. And I mean romanced it. It was a great show as far as dialogue, but as far as when they were laying sick and vomiting, you just kind of looked past that. It romanced it. But until that's the picture these kids see in 5th grade, 6th grade, 7th grade, 8th grade, 9th grade, 10th grade, it can't be an auditorium like this because the kids are going to giggle over here. You need to get small groups and get these people in to help. But as a community, now that I am back, I'm back because it is a small town. And we need to start having some phone people that answer phones when people need. I have gone through a lot in my life. Depression, all of that. But when I pick the phone up and say, help, I get, well, what did you want? And, well, she can't call you back for 2 years. I have offered to volunteer at several places and schools and committees. I've not had one phone call. I have been through this family-wise, kid-wise. I was recruiting junior and seniors for 10 years. That's why I do this. And all I did was get their heads turned around, change their grades, and get them out of college. It doesn't take all your money that you don't have and all these things. We need the church basements. We need the auditoriums. We need some canoes. And we need some fishing poles. And we need some things to get these kids out of that depression. And we need to understand. And if you have funding to send me to UPenn for positive psychology, I'll come back and do it all. So that's all I got.
Thank you. Could you give us your name for the record, please? I'm sorry.
They all know it. Somehow they all know me. Patty O'Kelly.
Thank you, Patty.
Good evening. My name is Stephanie Campbell, and I'm the Director of Policy for Friends of Recovery New York. I just want to express my gratitude to my senators who I've been speaking with, having conversations with, and a new Assembly friend. Thank you. It's awesome to meet you. I also worked with the Assembly minority on that task force, and it was fantastic, and there's some great things in it. I also, though, want to say that my name is Stephanie Campbell, and I'm a person in long-term recovery. And what that means is, thank you. What that means is I haven't used drugs or alcohol for 15 years. And what that's allowed me to do is it's allowed me to be a mother of 2 beautiful children, one who turned 21 today. It's allowed me to be a wife. It's allowed me to be an employed person. Prior to my coming into recovery, I must have cost New York State taxpayers a couple of millions of dollars, maybe. So I've saved you guys a lot of money. And I hope that Devin and Adriana, is it Adriana? Ariana, continue on this journey, and let's stay connected. Let's get connected. Alexis, you are amazing. Just blew my socks off. I'm sitting over there going, who is this woman? Just really powerful, and I love what the last speaker said. We know recovery, and, you know, we know the problem of addiction. It's horrible. It's horrific. It's not just heroin. That's the drug du jour right now. But it was crack in the 80s, and the Rockefeller drug laws did not make that situation better, I'm sorry to say. What I can say to you is that as a person in long-term recovery, I know that, you know, I'm an expert in this field because I'm doing it, because I have battled addiction, and because, you know, I'm here as living proof that recovery works. And so, you know, in the conversations that we've been having, you know, which is incredible, that we're now talking about we can't incarcerate our way out of this, right? We need treatment. We need education. We need prevention. But we need recovery. Someone comes out of crisis, and they leave treatment, and they go back into a drug-infested housing project, you know, system, which offers no supports. There's no recovery community organization. There's no recovery community centers. There's no recovery coaches. There's no family navigators. We're setting them up to fail. And we have to stop doing that. And we do have to invest in the solution of recovery. So I just want to, you know, reiterate, last month in Buffalo, there were 23 overdoses in 1 month. It's not getting any better, and we know that. But there is a solution, and we're calling on our representatives in the legislature to put more money. We're asking for $50 million. That's a drop in the bucket. We need $50 million for recovery supports in the community so that we can do recovery, so that they don't have to go and visit our friends over here, you know, so they don't have to wreak havoc and tornado through life and possibly die and leave their children, you know, parentless. So we do ask that this disease of addiction is treated as a chronic illness, not as a moral deficiency. And we need that funding now. Thank you.